Well, good morning, everyone. Here we are at day 3, and we've learned a lot of things, I think, in the last 2 days. Today, I'm going to talk a little bit more about partnerships and collaborations, mainly from the standpoint of the new Romanian Association, and some of the things that can be thought about as the association grows on how you can work with other groups in the country and within the healthcare community. So let's get started. The other day I started with a quote from one of the presidents, former presidents of the United States. So today I'm starting with a quote from one of the very famous entrepreneurs and business people from our country, Henry Ford. And Henry Ford was the person who figured out how to do an assembly line and make cars. But this was Henry's philosophy that when you come together for the first time and you first meet somebody, you have a beginning of a relationship. If you stay together in the relationship, you can make progress. You can do things by getting to know someone and working together. And finally, working together, you can have success. So we're going to start on that journey today in this presentation. When you talk about partnerships and collaborations, we really are talking about teamwork and putting teams together. A lot of times when you think of teamwork, you think of your little work environment and, okay, I'm going to work with the people I see every day. But teamwork is something that you can do all the time. You don't have to see the people every day. You can work with them to accomplish a goal. The other day we talked about start having a mission and setting goals for what we wanted to accomplish with the association. So in order to accomplish those goals, it takes a lot of work. One person cannot make that happen. We need a lot of people to join together in a team. Once the association members get together and start talking, the first thing that they'll find out after a few conversations is that they really need to start some outreach to some other professionals in the community. So the teamwork will bring a variety of experts to the planning and development process. So you might be talking about renal disease. Jesse talked about renal disease yesterday. And you might say, gee, we should write some standards, or we would like to write a paper about renal disease. When you start thinking about that paper, you will write down all the things you want to write related to nutrition. But when you think about it, you probably go, gee, we wish we had a physician or a doctor that worked with renal disease to give us some input to this paper. What does he think, or what's some of the philosophy of all the physicians that work in this area? You might want to talk to some nurses. Nurses play a big role in renal disease, in taking care of the patients. So they might have some insights that could be part of the position or what you are looking at to develop. You might want to walk over to a business. There's a lot of drugs and machinery that are part of renal disease and taking care of the patient. Could they contribute to the information you're trying to develop? So that would be a variety of experts that would be coming together. Once we expand that resource pool, we make it available to complete the project. So you tell people what you want to do, the goal you want to accomplish, ask them if they'd like to be part of the team that will accomplish that goal, decide how everyone will be recognized if they join the team, and then you can begin work on the project. The advantage of this at the end of the project, when you're all done, and sometimes this can go on for a year, it might not be a project that ends quickly, But at the end, when you have your product, which might be a position or practice guidelines on how to work with a renal patient, what you will do when you try to take your work out into the marketplace is it's easier to get support because you can say, look at all of the team that worked on this. This is the consensus of all these people on what is the right thing to do for these types of patients. This is a good time. We talked about values and the other day a little bit and how important things like ethics and values are in an association. And at this time, and when we're talking about partnerships and collaborations, one of the important values we should look at is inclusion. Because inclusion allows the differences in culture and personal perspectives to become an organizational strength. Two things can happen in an organization sometimes. If we don't respect each other's cultural and personal perspectives, we can start arguing. We fight. Everyone thinks their opinion is the most important opinion. It's important when we get into building teams and partnerships and collaborations that we look at that this is an organizational strength. We allow everybody to voice their opinion, and then we try to work to coming to a common place where we can all work in that place. Now, that doesn't mean everybody gets their way. We will also learn when we have some give and some take, but we will learn to do that. But if you don't think about including a lot of people and a lot of opinions as you're developing your projects and programs, you will not have a strong organization. The more you can be inclusive of everyone around you, the better you will be. I think this conference has been a wonderful, wonderful example of inclusion. Think of all of the people that have been here. Think of all of the people that have presented, all of you in the audience. It's been a very inclusive group of chance to network and to get together to try to move this new organization forward. In the food and nutrition community, the strength of partnerships and collaborations really nurture strategic relationships and networks that really empower the dietitians to be the industry experts. We spent the last session yesterday talking a lot about how to get dietitians out into the community. We were talking about student placements, but all of those places we talked about are potential work environments for dietitians, because a placement would be where you would want to ultimately also be a work environment. So in order to do that, you have to make sure that you outreach to the people that you think are important. And then they will understand that dietitians are an expert in the industry. They won't be, as we would keep saying, they don't know who a dietitian is. We need to get dietitians out there more. One of the things that you have to think about are, who are all these partners going to be? Every project you're going to have to ask that question. And one of the things a word you'll see used a lot, especially when you're doing strategic planning or putting down your goals, is stakeholders. Who are all the people that could get influenced by the decisions you're making? Is it just dietitians, or is it the community? Is it your patients and your clients? Is it another business in the community? Who can help you get your message out? So where are all of those partners? I was going to stop at this moment and have you talk about this, but maybe we'll do that in a little different way later. This is a list. When I was putting this presentation together, I found this fun picture of all these people walking down the street, and I thought, boy, all those people could be partners. We don't know anything about those people, but who are they? Maybe they are some of our partners. And then I started just putting down words of people that I think are important to dietitians. And you're probably looking at some of those going, some of those, I'm not sure how those are my partners, so I'll explain a couple of them to you. Certainly physicians and doctors are important. We've talked a lot about that. We've also talked about some physicians and doctors helping the establishment of the organization, but also everyday dietitians working in healthcare probably meet doctors and talk with doctors, so we need to know about them. There's a lot of potential doctors on this campus, so to the student dietitians, I suggest you go out there and talk to the fellow students on campus, because you'll get to know some doctors who are in training like you, and you'll carry that relationship forward. Nurses are key people in healthcare, and they can be such good partners in helping with good nutrition and good lifestyle. Universities. We're in a university. If it wasn't for this university, we might not have been able to have this conference. They've provided us with not only the facilities for our conference, they've provided us with speakers, they've supported the program, and all of those resources that are needed to put on programs and to develop things. So it pays to have good contacts with the educational community. As the association begins to build and want to have continuing education. Well, how in the world are you going to do that? Where are you going to hold the continuing education? If you want to bring together 50 people, most people can't do that in their living room. So you need to find a public facility, and many times universities will support that kind of work because it's part of what they do. It's part of their mission to educate, and they don't think about it just for the students enrolled. Many times they look at their community and they want to be part of that. Teachers, never lose touch with your teachers. You have such wonderful, wonderful relationships with the teachers you meet. Teachers never forget their students. They love their students, and I used to be a teacher, and to this day, when I go to a conference in our association, I always say I always know when one of my former students is behind me and they see me, because they go, "Miss Lechowich." No one calls me Miss Lechowich. The only people that call me Miss Lechowich are my former students. So I always know I have a former student. But to this day, those students were many, many years ago, but we still have that relationship. We still talk. Some of them have helped me since I changed roles and they went out into practice and I needed some experts. One of my former students in our country is one of the leading experts in diabetes. So whenever I'm looking to talk about that issue or I need an expert, I pick up the phone and I remember that student, and she remembers me because I was her teacher. And we easily have a conversation about things. And she's also one of the students I'm most proud of because she became a member of our board of directors at one time. So I always felt I accomplished. Teachers like to see the accomplishments of their students. Now this next one on the list, you're probably going, what in the world? What in the world would I do as a dietitian with the public transportation system? Well, I don't know what it's like in Romania, to be honest. But in Chicago, where I live, on all of the buses, when you get on the buses, they have little signs that advertise things. They advertise products, they advertise all kinds of things. Well, the dietitians in Chicago went to the public transportation system and asked, you saw that we have a National Nutrition Month. So during National Nutrition Month, we like to promote our profession and our message. And so we asked if we could come up with the money to make the signs, could we put them on the buses for no fee? And you know what? They said yes. So we were lucky all through the month of March last year in Chicago. When people got on the buses, they saw our message of, what was our message? The plate. Our plate message. But it also said, talk to a registered dietitian. So in the morning, people very sleepy on the bus going to work could see a little message about nutrition. So we partnered with our public transportation system to do that. So it's kind of an unusual partnership and one you might not think of because you tend to stay in the healthcare partnerships and you have to think about, whoops, if we want our message out to the people, where are the people? And people are on buses. Food companies, we talked a little bit about that yesterday as a preceptor place, but food companies can be partners in developing some programs, particularly ones that might be going to the public. The important thing as an association is you must keep control of the message. When you work with food companies, they have messages, you have messages. So you have to, at the beginning, do some negotiation about how will the messages go out, who will take charge of the message. And the association needs to maintain that control, but they certainly can partner with someone because they really want to work with the professional community. I put down grocery stores and grocery store owners. This is one of the fastest growing workplaces for dietitians in the United States. We have one grocery store chain. It's kind of small. It's only on the East Coast, so that New York, Philadelphia, Boston, you may have heard of those cities. It's called Hy-Vee, and they have grocery stores, supermarkets. They employ over 125 dietitians in that company. One grocery store chain. And the reason they did that is they had a couple of dietitians, put them in a store, and they found out it became a marketing advantage for them in the community. What the dietitians do, and they have learned, is we teach consumers a lot about what do they want to eat and what should they eat. But you know, we tell them that when they're sitting over in a conference hall or in an office with us. They go home, they get busy with lots of other things. Somehow our message might not stick. So when do they think about food? When they go to buy it. So what a wonderful place for the dietitian to be. So the dietitians actually work, they do tours, they do programs on how to read a label. They can go right up to the shelf in the store, take the product off the shelf, have the customers there reading the labels. They do they sometimes do food demonstrations and that kind of thing. So that's a good partner. Politicians, we have talked enough about politicians in the last couple of days, that this is where you have to learn to use politicians in the public advocacy of your country to get your message across. And lastly, consumers. The consumers are your partners. They are the people that you want to hear your message and to believe it. So you should look at them as a partner and not just somebody you're giving information to, but how can they help you with your projects and programs. You're going to hear a little bit about international networking soon, so I'm going to quickly go through this slide, but I did notice when I went and looked at the EFAD website how many partnerships they have. These are just a few of 10 that they have on their website. So I suggest you go to their website and look at all these different programs and who they've connected with in the European community through the EFAD organization. They have a lot of alliances in public health, in diet, physical activity, and health, in the Food Information Council. So you already have a chance to work with this resource because now you are, I believe, an alliance member with this organization. These are some examples. I thought if I was talking about this, you need an example of something that really happened. So these are a few that we've done through the association that I work for and with other partners, and to give you an idea. One of the things we do is joint position statements. We take positions, and one of the positions we have is in the area of sports medicine, and that position, when we wrote it, we brought together our association, the Dietitians of Canada, and there's a group called the American College of Sports Medicine, Nutrition, so we wrote a paper on sports medicine, nutrition, and athletic performance. Also, when we take that paper or use that paper, we can say all these organizations support the work that's in that paper. I'll tell you, that is really impressive when you go and take that paper to, say, a politician and say, here's our position, this is what we believe, to see all of these people were part of that. We've had some interest on education guidelines. We've done some work with our American Geriatric Society, and they've established some standards for education for all healthcare providers. So for physicians and doctors and nurses, and they had a team of all those people come together. And we as dietitians sat on that team, so we are sharing in those guidelines. So that's a way of coming together around education. And we did that, the American Geriatric Society was the lead organization, and we were a partner with them. We also work with some of our quality management people, and there are a lot of people in our country who set guidelines on what's the best way to work with a group. And so one of the guidelines that was established was on the management of food allergies in the United States. And with that paper, over 34 professional organizations came together to write that paper. So that alone is it's amazing that a paper ever came out because that's a lot of organizations to come to agreement. But that has happened, and it's something that's used by all of the people participating. Also, it's important to build some coalitions around public policy, and we have done that a number of ways you can do that. We've held Academy members being keynote speakers at conferences. One we did on aging in America that was sponsored and was done in our nation's capital. So it was really important that a dietitian was one of the key speakers when all of these people from all of our government offices came. Also, we lend expertise, what we call Hill briefings. So it's going up and talking to the congressman. How do you do that? That sometimes is a scary thing to do. So we do that, and we've recently done some in the area of pre-diabetes. Public health projects. We talked already a little bit about our program called Kids Eat Right. The other one, called Building a Healthier Chicago, is quite an interesting thing. It's a coalition of over 126 organizations in the Chicago marketplace, just the city of Chicago. It is everything from business and industry, it's people who make products, it's professional associations, and in fact, I'm missing their meeting, which is today, back in Chicago. And we come together about 4 times a year, and there's all kinds of programs that are going on in some of our poorer communities and healthier communities. They sponsor bike races. One of the big projects we had, we talked a little about vending machines. Dietitian led that project. In all of our parks, we had vending machines, and they've now put healthier foods in the vending machines in all the parks. So that was real important from the dietitians, but it was through that coalition. They helped to get to talk to all the people you need to talk to when you want to change all the food in all the parks and who runs those. And then lastly, leadership that we do a lot, we see in our media. We have some work in food service, and we were so excited because 2 of the Academy members were listed as the 20 most influential people in our food service community in all of the United States in the publication Food Service Director. And then we had one of our members in public health through the Association of State and Territorial Public Health Directors, who received 2 awards in recognition. This last little piece I put in because I wanted you to think of this very personally. And every day when you go to work, you are on a team. You are not working alone. And so when you go to work, you have to think of, what is the group of people I work with? How do I understand how each of us need each other? What are we doing? How am I using my colleagues, and what can I contribute to them? And you can't be shy and wait for them to come to you. You have to be able to go to them. The ultimate thing is the patient is the most important. But they need to become your partner too. So that's the common purpose. You want to help someone become healthier. And to be effective on a health care team member, you need to include the patient. You must understand that each team member is unique, and that where there is a shared responsibility among all of the healthcare people. So teamwork and partnerships and collaborations go from the association, but it goes down to you every day in the work environment. And for every partnership and collaboration you form as a dietitian, you have formed it for the profession. And remember that every day when you're at work, that you are working for the profession in the whole country. So I thank you, and I will see you a little later today, but now, are you going to introduce?